Have you ever experienced back pain? Have you ever had pain flare up from arthritis? Have you ever had joint pain with constant swelling and inflammation? Or aches and a fever that just won't come down no matter what you do?
Hi, Future RN here, and I have a medication that just might help. It's ibuprofen. Ibuprofen is an NSAID, which means it's an anti-inflammatory, pain reducer, and fever reducer. It can treat minor aches and pains due to headache, toothache, backache, minor arthritis pain, and the common cold. You can take ibuprofen by mouth or by IV in a medical setting. Ibuprofen works by inhibiting the synthesis of prostaglandins. Prostaglandins are a group of lipids synthesized at the site of tissue injury or infection that acts as a signal for the body for inflammation, pain, and fever. So how do you know if ibuprofen is working? If you see a reduction in your pain, fever, or inflammation. Now let's hear from a patient about their experience using ibuprofen.
Back in my day when we had aches and pains, we just took a shot of whiskey. But now thanks to ibuprofen, I can drink for fun.
While it's nice to have fun, try to remember to avoid alcohol while taking ibuprofen, and that by having 3 or more drinks within 24 hours while taking ibuprofen increases your risk of gastrointestinal issues. Instead, try to take this with a glass of water and remain upright for 15 to 30 minutes after.
People with allergy to NSAIDs or salicylates should not take ibuprofen. Other contraindications include cardiovascular dysfunction, hypertension, peptic ulcer, history of GI bleed, pregnancy or lactation, or post-recent heart surgery. Ibuprofen can cause nausea, indigestion, constipation, diarrhea, flatulence, GI bleeding, platelet inhibition, hypertension, bone marrow depression with chronic use. Warning: ibuprofen can increase your risk of cardiovascular thrombotic events. This risk may occur early in treatment and may increase with duration of use. Warning: ibuprofen increases the risk of gastrointestinal adverse effects, including bleeding, stomach ulcers, and stomach and intestine perforation. The elderly and patients with history of PUD or GI bleeding have an increased risk. Remember, don't let pain, inflammation, and fever get you down. Talk to your doctor about ibuprofen now.